Hello. I just wanted to talk about common ferret illnesses and health ailments that you might run into while owning a ferret. And what should you look for when you're bringing home your new furry friends and you're quarantining them for those 2 weeks. So let's start off with something important. Where did I do my research? So the books that I used are Ferrets for Dummies, 3rd edition, and then Animal Planet Ferrets. Both of these books have a lot of really good information in it. Then I also looked at videos on YouTube by Pazu and Friends. I also looked at Holistic Ferret. They've got a lot of really good articles, and then the American Ferret Association has a lot of really good articles as well. So I hope you enjoy what I've researched. I needed an assistant, so meet my daughter. Hi. We are just going to talk about common things that you should look out for. So the first one is ECE. That is going to show up in green and runny stools. And then the next one is going to be a blockage. That is when they eat something that they're not supposed to eat. The next one is adrenal disease. That is when they're underproducing hormones. And usually you can tell because there's some hair loss or some behavior changes. The next one is insulinoma. That is when they get pancreatic tumors. Usually it's because of your ferret's diet and because they are consuming sugar. It's more common in kibble-fed ferrets than raw-feeding ferrets. However, any ferret can still get insulinoma. The next one is heart disease, and there is 4 main types of heart disease. There is electrical, which is like an irregular heartbeat. There is valvular, which is when there's something wrong with the valve. Muscular, which is like an enlarged heart. And then heart failure. Any of these you have to have diagnosed through an echo or an x-ray. There is a variety of symptoms that you will see. The next one is IBD, or irritable bowel disease. That one is honestly super commonly mixed up with Helicobacter. Helicobacter is a bacteria, and they both have the same symptoms. So you just need to go to the vet because IBD is going to be something that's more long-term that you control through diet and a daily medication, whereas Helicobacter is something that they just need antibiotics for. It's a pretty strong strain, so it usually takes quite a bit of medication, but yeah, so they have the same symptoms, but watch out for both. The next one is going to be cancer. So there are 3 main types of cancer. The first 2 we've already talked about: insulinoma and adrenal tumors. The last one is lymphoma, and lymphoma is probably the most common besides the adrenal tumors and the insulinoma, and it can present in any ferret in any age, and 24% of ferrets actually do not show any signs or symptoms of cancer. That's why I suggest when you're doing your weekly check-ins and you're doing their grooming that you look for things like tumors or just anything that's off. The next thing that you should look out for are teeth problems. Ferrets should get their teeth brushed at least once a week, but they can get chipped teeth, they can get tartar buildup, all sorts of stuff. You should take your ferret to get their teeth cleaned like once a year. Another thing to look out for is bladder stones or a urinary tract infection. Then there are common parasites like fleas, ticks, and ear mites. And then the last thing that I think is really important for you to know is that your ferret can catch the common flu. So if you are sick, take precautions. COVID-19, the flu, anything like that, you want to wear a mask, you want to wash your hands, wear gloves if you can, even have somebody else take care of your little furry ones for a little while if that's available. But yes, they can catch the common cold.